take a seat right there.
So I was involved in the pilot trial for using psilocybin for cancer patients with demoralization and chronic pain.
When we met 29-year-old Wesley Appleberry at the end of 2022, he had gone through treatment for stage 4 cancer, Ewing sarcoma, and after that, he had lost his own father to cancer. Demoralization is common in cancer survivors and can include feelings of hopelessness, helplessness, and a loss of meaning in life.
I cry every day. It's hard to get any joy out of anything anymore. It's hard to feel like I belong anywhere. I guess that's a big part of it. I really don't feel like I belong.
Do you have any last questions before we begin?
Wesley was the first patient in the trial that used psilocybin, a naturally occurring psychedelic compound found in certain mushrooms.
Cheers, guys.
I think the psychiatric community is very split.
Psychiatrist Bodhi Dunlop is the co-director of the Emory Center for Psychedelics and Spirituality.
This is an important study because we need to establish the safety and the efficacy of the application of psychedelics. It may be that this is not going to work. We cannot just assume the answer in science. We need to build an evidence base.
Let's take a journey inside of our bodies.
After multiple assessments and hours of preparation with a psychotherapist and spiritual clinician, Wesley had his experience.
I guess there's that spark of the divine in me. I've already got the white light that I need. That's cool to say out loud. Yeah, you know, seeing that like goodness in myself for once, maybe the first time. I think I've always felt it, but I've never been able to like get this close to it.
In his integrative sessions after the psilocybin experience, Wesley talked about the massive shift within him.
I guess transformative. You know, I like finally came into myself. You know, I don't feel broken anymore. I don't think I ever would have made it out of Milledgeville, Georgia without the psilocybin experience. I really and truly felt trapped.
Wesley also made a massive shift in the world around him, leaving his hometown for Columbia Theological Seminary in Decatur, Georgia.
I'm a Columbia Scholar, which is one of the highest merit scholarships that the seminary offers. I'm in the dual master's degree program here at Columbia Theological Seminary, working on Master of Divinity and a Master of Art and Practical Theology with a concentration in pastoral care. I'm also working on a graduate certificate in intercultural chaplaincy. I want to be an oncology chaplain.
It has been 2 years since Wesley's psilocybin experience, and a lot has changed.
I was honestly in shock. I never thought it would happen again.
His cancer returned in May of 2024.
Since May 9th of 2024, when my annual PET scan discovered my recurrence of Ewing sarcoma, I've gone through 2 surgeries, 5 rounds of chemo, and by November I'll have completed 28 rounds of proton radiation.
We were there when Wesley finished his treatment a second time.
Thank you. The psilocybin experience really gave me my life back. It allowed me to feel like I had agency again. It allowed me to process a lot of the trauma. It allowed me to reframe a lot of the negative thoughts I had around my dad's death, around my own cancer, and around just a lot of the trauma I had experienced throughout my entire life.
2 years after that pilot trial, the results are in.
We saw many people do better in terms of their demoralization and their management of their pain. That trial was a pilot trial. It was to get us going. Everybody got open label psilocybin. There was no placebo. So any conclusions would be, you know, with that in mind. They're tentative. They're to generate data to help us structure a proper randomized clinical trial as a next step.
The Center for Psychedelics and Spirituality has expanded to other psilocybin trials for depression, including treatment-resistant depression, end of life, and postpartum depression. Psilocybin is being investigated for a vast array of conditions across the country, from depression and mood disorders, to addiction, to anxiety and PTSD, to chronic pain and palliative care.
I've certainly seen a number of patients do quite well on the medicine. I think I have more expectation that people can improve, but I've also seen some people not do well and actually worsen. So where I am today is this treatment really needs a lot more careful investigation, and we need to be able to better tailor it to the individuals most likely to benefit versus those who could be harmed.
As the research continues and data gathering goes on, Wesley moves forward, transformed in ways that research methods are struggling to fully characterize and measure, such as those intangible changes in perspective, connectedness, and meaning.
You know, I've been through a lot the past few years. I'd be lying if I said it was easy, but this experience has absolutely made my life so much better. I never could have imagined my life being as good as it is today without the psilocybin experience I had.